I'll call the City Council and Native Village VAC Tribal Council Joint Work Session of April 22nd, 2020 to order at noon. Chairman Olson, if you'd like to call the roll of the Tribal Council.
Thank you, Mayor Copeland. Tom Anderson. Here. Pam Smith. Present. Jack Hopkins. Raven Cunningham.
Present.
And Daryl Olson present. We have 4 out of 5 council members present. I'm sure Jack will get on shortly.
Okay, thank you, Chairman Olson. If I could have the clerk call the roll of the City Council.
Sure. Mayor Copeland.
Here.
Tom Baylor.
Here.
Kathy Sherman.
Present.
Jeff Guard.
Here.
Melina Meyer. Ann Schaefer.
Here.
David Allison.
Here.
David Gleason.
I'm here.
That's a quorum of council.
Okay, thank you. So I know that we were looking at having a joint meeting on Thursday, and we postponed it to here, and lots changes on an almost daily basis. So we do have kind of a placeholder work session topic here. But before we start the discussion, I thought, Daryl, Chairman Olson, I might just pass the floor to you for a minute to start out.
Okay, thank you. I did want to mention that the Native Village of VAC, we did pass the resolution before the council, and we did present it to the council. And the resolution, we worked on the resolution for 8 days, and in that time, a lot changed, but we did unanimously pass the resolution, and we did forward the resolution on to the City Council and the Governor, realizing that a lot had changed since then. So we just wanted to afford the City Council a copy of the resolution, and it is included. And I personally have reached out to every council member except for one who I left a message. But if you guys have any questions or comments on the resolution, we're more than welcome to discuss it. And that's all I have at this time.
Okay, thank you, Chairman Olson. City Council, any comments or questions? Bear with me, Council. I'm just getting a checklist so we can go through the Council in an orderly manner. But I'm not hearing any questions at this time. So I'll open it up to City Council. Do you have any questions or comments or suggestions for this work session or for the Native Village of EAC? And I'll let you think for just a second, and then I'll go through a roll here. And I guess this is just a general discussion, so any observations or general comments or concerns in this forum are welcome. And I'll go first to Councilman Schaefer.
Hi, yeah, thanks, Mr. Mayor. I guess my only question or comment or idea right now is just brainstorming ways that we can work together for the community. I'm not sure what that infrastructure is, but I'm not sure like how much progress has been made integrating members from NVE onto the IMT. But yeah, just different ways to incorporate both leadership entities for the response.
Okay, thank you, Councilman Schaefer. And before I proceed, I did want to give you a quick view from the room here at City Hall. It's myself, Councilman Baylor, City Manager Helen Howarth, Jason Gabrielson, our IT managing the YouTube, and then we have Susie Hirschleb, who's on the incident management team, also Aaron Muma, and then your incident manager and deputy, Paul Trombley and Mike Hicks, and then the city clerk, Susan. So Councilman Sherman, did you have any comments?
Not at this time, although I know there were some suggested topics that maybe we could work on that Bert produced for us. That's all I have.
Okay, thank you, Councilman Sherman. Vice Mayor Meyer. Not sure if you had a chance to.
Yeah.
Okay.
Sorry, I was just a couple minutes late right after the roll call was already done. But, I agree with Kathy. Maybe we could just go down the list that Bert produced. Because at this time, I don't have anything to add.
Okay, thank you, Councilman Meyer. Councilman Allison.
Yeah, just more of the same. Like to hear how we've made any progress on integrating them into the IMT and whatever we can work together on.
Okay, thank you, Councilman Allison. We'll park that question. Councilman Guard.
Yeah, thank you. I guess my only question that hasn't already been raised was, we talked before about everybody coming up with a list of resources available to them from the NVE side and the city side on that, see where we might have holes, duplications, or that. I was just wondering what would have been made on that yet.
Okay. Just taking a note here. Councilman Gleason.
Yeah, I'm with Kathy. Just go over the same stuff Kathy said there. That's all I got.
Okay, thank you. Councilman Baylor.
Well, I guess I find the question kind of interesting if council's being asked to stay in their lane and just do policy. I'm not sure what, I think it's up to the incident command team to bring us where their holes are and where they could integrate. And if there's anything that council can assist in that, I mean, surely we would support that, but I don't know what holes they have or where they need personnel. And as I think we all support our medical team working together, and if they need to kind of work that out amongst themselves. So I'm not sure we can give any direction on where to integrate anybody, but I think everybody on council supports working together and look forward to those added resources.
Okay, thank you. So I know council asked a couple of questions here, and I'm not sure that the incident team's ready to answer right here on the spot, but with that, and basically those questions were, and correct me if I didn't capture these correctly, has there been progress in integrating the Native Village VIAC into the incident management team? And have we identified any areas where there's duplications of efforts that could be, I guess better divided? So Deputy Incident Manager will speak briefly here, or speak to that.
Briefly, yeah, we were waiting on you two groups to get together. We were supposed to have this meeting last week and it was canceled. We were waiting on both the council and the Native Village VIAC Council to get together and iron out, there was a few legal issues that Helen had spoke to at the last meeting, and then we were supposed to have a meeting on Monday and that never happened. So we're kind of waiting on a little bit of direction, I guess, legally from you all between the two groups. Does that answer your question?
Okay, I think so for now. So, Chairman Olson, I'll turn the floor back over to you.
Okay. At this time, could we go ahead and, if you guys don't mind, have Bert go through his list?
Please.
Bert?
Thanks, Darrell. I produced a list a couple days ago, mainly to, so we're not going in circles in terms of working together or trying to figure out how we're going to work together. The list was just examples of ideas of things we can possibly do together from the Native Village of VX site, not knowing what happens on the city side. So, you know, the procedures between incident command and city, for example, part of what was on the agenda last week on Thursday was the airport plan, and for the Native Village of VX to participate in that or develop it. But the incident command, based on the plans that I've seen, has done a great job with that. And I think it's counterproductive if NVE does that, where we could just offer any assistance or help that they may need for that plan. So, you know, for the first, that answers the first part of what we were supposed to talk about last week on the airport plan. There were some legal issues also that came forward. The procedure to talk about that is what I don't know. I don't know if we talk about that in this meeting, and if it's something that our legal counsel and the city legal counsel gets together and talks about. I would take direction from you guys on how to proceed with any of the legal issues that have been talked about. So I have not talked to my counsel about the ideas or the examples that I gave on things that we can do to work together. And when I gave those, like I said, they're ideas. I don't want these meetings to be not productive. Are there things we can do to work together? What does that mean? If there isn't, then there isn't, you know. But I do think that regardless, myself, Helen, Clay, Darrell, our staff, our medical teams, they already are working together. And so, you know, I think one question is, how productive are these meetings? Do these meetings need to continue to happen as a joint meeting, or should they happen as needed? And that's a discussion that I think both governing boards should have. So I'll leave it at that. Thanks.
Mayor Copeland, this is Sherman.
Councilman Sherman.
May I just ask for clarification, maybe from the city manager, where do we stand in the legal review of integrating members of NVE into the IMT?
So at this point, the incident command team is set up not as a representative body, but as a body that is made up of people that have been trained in and have a specific skill that could help make the incident command team able to do their tactics to support what needs to happen on the ground. So there isn't any legal reason why someone from NVE couldn't participate, but we cannot say that the executive director or any specific person will be serving a role. We are looking. Apparently, we're looking for roles. That said, I, as city manager, do have a very specific role, as any other city manager will have. And the incident command structure is set up on the federal level, and it's set up with a very specific purpose in mind. And so the understanding is that we wouldn't have two city manager type positions on the incident command team just based on the legal structure, the federal structure that's been established. And there's definitely room on the incident command team for people to participate from any entity, and especially the tribe. And I think our goal at this point is to identify places where the incident command team needs assistance, and bringing that to Bert and saying, is there anyone on your team that could potentially fulfill this role? So I think that's where we stand. Paul or Mike, do you want to augment that? That's where we are. There's no legal reason not to include someone from NVE, but we can't adjust the structure that's been defined in code and by the feds.
Yeah, we need volunteers to fill certain positions, preferably ICS trained. I know there's some folks over at NVE that have some training, and depending on their training, we might plug them into one role or another. If it's an office staff person, it can help finance or something like that. So I'm thinking along the lines of we could put together a list of positions we need to fill and provide that to NVE, and anybody in the community for that matter is welcome to assist. We had 2 people, one person volunteered last night, and she's going to fill in the demobilization unit role. She's good at what she does, and she'd be very good, even though she hasn't had much training in that. She has some ICS experience. So as far as the airport goes, there's a group of volunteers out there now that are working under our umbrella, under our structure, that have a specific set of protocols that they follow. After we research everything with the state as far as people filling out the travel forms and so on and so forth. We have a specific set of rules. So if folks wanted to volunteer for that, anybody is welcome. And we'll put them through the system, through the person that's running that operation, under the operations section and the port of entry group, and we'll put them to work. It's as simple as that.
Mr. Eric Olson, this is Raven. May you speak?
Yes.
I'm sorry, we're having a hard time hearing you, so I didn't quite catch the name.
Oh, this is Raven.
Oh, okay. Raven.
May I speak?
Yes, go ahead, Raven. Thank you.
This is kind of just from what I've observed. I believe that this is going to be a lot longer than a lot of us may assume. I think that it would be very smart if we duplicated roles so that people weren't exhausted from the position. Like having somebody work under one of the main positions, just so that there's more than one person. When that person becomes tired, somebody could step up and already know what's going on.
And we're working toward that end. We've got, like in the command position, we've got a command and a deputy, so we're interchangeable. A lot of this is driven by whether or not the person has ICS training. For someone to, like in an incident commander's position, to replace that person, it has to be ideally someone with equal or more qualifications. They have to be interchangeable. So that's kind of the tough part. And, in some cases, we'll have to take what we can get. So like if our finance department needs extra help in the finance department, we could maybe plug somebody from NVE, let's say, or the Wells Fargo Bank, somebody with financial experience into those roles as assistants or deputies. So that's a good point. And, right now we're still struggling to fill all the roles we need, and then of course secondary would be deputies and assistants and stuff like that. So so I think a good starting point is we could put together a list of some of the folks and the qualifications we need on the team, and put that out there for folks that have interest to fill those and see what happens.
Mr. Mayor?
Yes, Councilman Garden.
I got a quick question. It sounds like the incident command training is of fairly high importance to be functional in the ongoing efforts here. Is there any way we can start getting some ICS training for other folks? Can that be done online? Or is that something that needs to be in a classroom setting and would make it more difficult during the COVID time?
You can go to the FEMA website, FEMA.org, I believe it is, and the basic trainings are ICS 100, 200, 700, and 800. Those are all courses you can take online. They shouldn't take more than, some are 15 minutes to an hour each. They're self-paced courses. You can take those online. That'll give you a basic understanding. The more advanced stuff, the ICS 300, 400, which we teach here, I'm one of the instructors. That's a structured class, has to be a classroom presentation. That's a 40-hour class, so that's not realistically something we can do right away. But the basic ones, anybody out there in the public, they can go online and get those courses themselves on their own, and it'll give you a basic understanding of what's going on, which is really good if you step into one of these roles. Even though you may not be fully qualified to do some of the stuff, it'll give you a better understanding of how they function.
Thank you.
Councilman Baylor.
This is Darrell. I have a question, and I guess it's more or less a clarification. I just want to make sure we're on track, and I'm on track. But so I guess what we submitted Bert's name to be on the IMT, and then we just recently changed that like 2 days ago because of the workload and everything. So we submitted Brooke's name. So will they be, I guess I'm wondering, will they be like a temporary, I guess I'm asking for clarification, what role NVE will have with the IMT, because it sounds like the IMT is a federal, a federal entity. So I'm just asking for clarification.
Okay, Chairman Olson.
It's not really a federal entity. It came out after 9/11. There was a presidential mandate that created the system we have now, the National Incident Management System, NIMS. And it's about a, 700-page document, the big plan. And it provided for, it mandated that we train people, and some of it drives grants. Like some of the council people need to be aware that they need some of this training because it helps us get grant funding. So it's not a federally mandated program, but it's a structure that it actually was developed in the 70s by the fire service, and it's kind of grown and adopted, to where it is today. So it's a system. It's not a mandate. And we could throw the book out the window and just go, helter-skelter, and it probably wouldn't work real well. But it's a system. It works. We've trained in it for many, many years now. And, yeah, so it's a system. And like I said, going back to what I said earlier, I think if we come up with a list of where we need folks, and if you've got somebody that kind of fills those qualifications or some of them that can be helpful, we'll sure take a look at where we can plug them into the system.
Okay, Carl, this is Bert. Say something?
Councilman Baylor.
So let me circle back to the other question about people being trained. And, we have a lot of people in this community that have gone through the SERVS training. They've gone through HAZWOPER, they've confined spaces. So they have a lot of good training already. So I don't think it's a huge jump to get them trained into this system. And I know there's some people in town that have been involved in this system, and I think Mr. Groff comes to mind and others that could certainly serve as a mentor. And so what I would have preferred to hear the incident commander say that we'll get somebody that's trained up on this, we'll set up a mentoring program, we'll have the information, and maybe we'll have, recommend people get online classes Monday through Thursday. I'll be there, or we'll have somebody there to answer questions and walk you through this and get you certified up. I mean, be aggressive and proactive trying to get people to help. Just to say, well, go online and then come get us, I think because I agree with Raven's comment, this is going to be a long haul, and we have city people serving on these positions. They're going to have full-time jobs to do too. So, now, all that being said, I realize you can't take a civilian and make them a fireman. You can't take them and make them a medic. You can't take them and make them a doctor, overnight. But there's a lot of positions, the airport. I can't see us having that served out there for volunteers. At some point, there's going to be burnout. We're going to need replacement. So I would suggest reaching out to one of your trained up personnel that maybe have the time. Everybody's doing this stay-at-home thing, and maybe set up a little, do you want to go online? Do you want to sign up for these classes and mentor them through it? I don't think it would take a lot of effort, and you might get a lot more volunteers.
Hey, Daryl, this is Bert. Can I say something?
Yes, sir.
So I don't want to, have this incident command go helter-skelter. But I think there's options with a unified command, and I think that should be talked about with Helen and looking into it and how we could go from incident command to unified command. The Native Village VAC, we will definitely train in who we have representing there, so we do a good job in representing our organization and the community. So I think we would want, like Daryl said, it isn't going to be me. We're putting Brooke into that and Dena to help along, and I would still be a part of it on the NVE side in terms of meeting with them on the information to relate to incident command or unified command. But if you guys could please look at the unified command option.
We have been looking at that, and we're almost there. We're not quite there yet, but that's a very good point. And I didn't mean that we were going to go helter-skelter. I just threw that out as an example. We've got an organized structure. We're sticking with it. And like I say, people don't have to be fully qualified. If you have a financial background, like I said, or just good organizational skills sometimes, depending on what the role is that we plug people into. Because we're a small community, and we've got community-wide, we've got some very talented people out there in all walks of life. We see it in the fire department all the time. I mean, we've got a huge group of folks there that are really talented. So, yeah, like you say, we'll get together and we'll see what we can draw from the community and from NVE.
And councils, I know this may look a little bit like sausage making. I want to kind of reiterate what Bert said a little earlier, that there's a lot of work going on between Helen, Bert, Daryl, myself, and staffs. So I don't want to leave the impression on the public record or with the councils that we're not working together on various fronts on an almost daily basis, whether it's collaborating on testing supplies or airport entrance plans and so forth. And I think one item that, just to add to Bert's list, one item that for discussion, or I guess a request that I heard from NVE, was that the medical structure be more of a team structure. And I think I heard in the incident management team meeting this morning that that has kind of happened, that we now have a medical team. And Dr. Sanders is kind of the spokesperson for that team, but that has been structured more as a collaborative.
Mr. Mayor, this is Councilman Schaefer.
Councilman Schaefer.
So kind of along those lines, Chief Hicks mentioned that they were waiting for direction from us in order to proceed, because we didn't have the meeting last week and then we didn't have it on Monday, and they were waiting for us to have this conversation before they proceeded more with the incident management integration. So I'm just wondering if he feels comfortable now with the direction that's been given to proceed, or if there's anything else he needs from us at this point.
Well, if I'm understanding what's said here today, I think that the legal issues have been cleared up to where we can proceed. But that was my only concern. The last meeting we had was that we were waiting on some legal issues, and if that's been cleared up, well, then we're good to go. But I don't
Okay,
have to,
that's good.
you guys will have to answer that.
I think, this is Helen, I think the question was as to what role NVE might play at the airport, and there was some question about how we might whether that would be a contractual thing or whether NVE would just step in and take it over. And those are things that we could administratively discuss. Bert and I can certainly resolve and make happen. So I don't think some of those conversations need to happen at the council level.
So Councilman Schaefer, I don't want to, I want to make sure that we're capturing your comment. When you say the direction that's been given, I want to make sure if council feels like they're giving direction here that we're clear on what that is. And, you know, whether it's policy direction to collaborate with NVE and avoid duplications and to the extent possible incorporating into incident command or whatever, is a little different than a tactical direction to, you know, you will put people on this task force, what, you know, regardless of what that does for the structure and so forth.
Yeah, I feel like my question was answered. I just wanted to make sure that they weren't still waiting on something from us that we weren't communicating.
Okay, thank you, Councilman Schaefer. Helen.
I just had a question. You know, I just want to be, make sure I understand, or make sure that we all understand what we all are doing. Are there any questions on the part of NVE about some of this very specific things in your resolution? I think we've got on the table and have been done, but I'm just wondering if there are things that you have direct questions about that might be priorities for NVE that we as either the incident command team or city council might take a look at. I really appreciate that you guys have, NVE has come forward and said, we want to help. And that is a really, really, really wonderful thing to know. I know we're also operating under different legal frameworks. The city has to work within a very structured and rigorous legal framework that allows us to do certain things and doesn't allow us to do certain things. And NVE, your framework is different as well. And so sometimes we don't have all the possible options to us that you guys might have. So there might be things that we just aren't capable of doing for whatever reason that you guys are. And so, and as we understand our legal frameworks and understand what we each bring to the table, I think there are some really wonderful options for working together. So just acknowledging that there are issues that are inherent in our respective organizations, I think is an important part of that, and we will learn as we go. But I'm just wondering, are there any things that in particular, in terms of this COVID response, that you as a tribe feel is really important for us to look at? Or any questions you might have about very specific things that were addressed in your initial resolution that we could answer?
Chairman Olson?
Yeah, this is Darrell Olson, and I think our number one priority, which is also the city's priority, is the safety and well-being of our residents. And I think the sooner we get a harbor plan, an airport plan, and a testing plan implemented, the better, because we are going to have these people come in, and I think the residents of Cordova feel much better when we have a plan. The worst thing we could do is not have a plan and publicly announce the plan, because then the residents are fearful, the residents are wondering what's going to happen. I mean, I think at NVE, I'm speaking for myself as the chairman, but to me, just having the harbor plan, which we do have, the airport planning, the testing plan in place. I know I feel totally comfortable that our hospital is prepared. I feel comfortable that our Elanca clinic is prepared. So just having these plans in place, because we are running out of time. So that's my concern. Council members, I'll go down the list. What, do you have any concerns or questions? Tom?
The same concerns you have, Bill, pretty much, okay?
Thank you, Tom. Pam Smith?
I'm just going to refrain from any comments at this point.
Okay, thank you, Pam. Doug Hopkins?
My concern is lack of enforcement for the mandates.
Thank you, Jack. David?
I just want to kind of go off of what you said. I think that you definitely hit the nail on the head. But my personal opinion is I see ourselves as leaders in the community that we're just tiptoeing around. And I don't mean that in disrespect, but just maybe that we need to check ourselves and constructively that we've done great short-term stepping up, but we need to simultaneously commit to a more sustainable approach because we are in this the long haul. We need to hold ourselves accountable and show the community that we're serious about the well-being. We need to wear our masks and gloves and be conscientious of our actions. We need to understand that we are being looked at every moment, and that we need to show the community that we're working on this and we are serious about the well-being and health of the community. Phishing is happening, and it's happening fast. And I understand, going off of what Helen said, that they have to abide by different rules than the tribe does, and they have to worry about the city as a whole. However, the tribe has responsibility to its tribal members, and they are permanent residents of EAC, which is Cordova. And I hold myself to that oath that I said after I was elected into my position, and my duty is to my tribal people and their well-being.
Thank you, Raven. And that's the other thing I did want to mention. I really appreciate the city making the mask covering a mandate, because I think that is going to help so much. So at this time, do you have the understanding, Helen?
Yes, I just want to, I think we are aware of and know about the harbor and airport plans. Those things are really getting locked down, and I will look forward to working with the tribe on some of the specifics of that. Enforcement, I think we need to work on that. We acknowledge, and I just want to share that the state, when we asked the question, basically what we heard, the state doesn't plan any enforcement measures and won't use troopers, National Guard to help with the mandates. The National Guard, however, will be used to extract patients from rural communities if needed. So if someone gets, if our hospital is not able to care for a patient because we don't have capacity room or their situation is more than we can handle, the Air Guard can be and will be deployed to come and pick up patients and take them to a hospital. So we do have that confirmation. But in terms of enforcement, we're kind of on the ground on our own, and Chief Hicks can speak to that. But the only other question I have, and I don't think we have a direction yet, is on the testing piece. So maybe that's something we could collectively work on as well. So I'll let Chief Hicks speak to enforcement.
Yeah, we are enforcing the mandates to the best of our ability. We have received calls and looked into those and investigated them. We have tools we can use. We can fine people up to $500 or a $500 fine and a mandatory court appearance. That the city passed that resolution for people violating a mandate. There are state laws that we can apply if necessary. So we are enforcing it, but fortunately, pretty much everybody's complying with the mandates and trying to do the right thing. And as long as we keep encouraging people to do that, I think we'll be okay. As far as the airport plan has been in use now for quite some time, and we're daily we're out there with folks, and it's being fine-tuned as it's work in progress. All of these things are work in progress. I equated it earlier to somebody about it's kind of like a survival situation. You survive the plane crash. You get out of the plane, you realize you don't have any injuries, and okay, now how do you make your situation better? You need to set up some shelter to wait for somebody to come and rescue you. So we're at that point now where we've put a lot of stuff, a lot of effort, plans, people, equipment into place for this thing. So now we're at a point where we're fine-tuning stuff and just kind of take a little step back, look at what we've got in place and how can we make our situation better. You always want to try to make your situation better. So for lack of a better explanation, but we do have this, it's work in progress, and we're moving forward sometimes at a snail's pace, it seems like, but we are moving forward.
But I think we all acknowledge that the burden of enforcement is yet to come as we get more and more people in town. So that's an area where I think we could certainly have a conversation for assistance there. And the whole notion of testing, there's a lot of differing ideas about how to proceed with that. And I would say that there's no clear direction yet.
Mr. Mayor, Councilman Gleason.
Councilman Gleason.
Yeah, I was just I'm glad Jack brought up enforcement because that is the main concern. That almost all of my calls are about that right now, and we recently received a letter from some concerned, a group that is bringing that up. And so my big concern is that we don't have the manpower we need, and I'm wondering, because once the whole fleet shows up, that's going to be a lot hard. It's going to be really hard for Chief Hicks and his 2 police officers to take care of the town and the harbor. And so is any of that federal money that we're supposed to receive, can we hire help for him with any of that money?
I'm sure probably, we haven't yet gotten the rules on how that is to be utilized, but it's for COVID response and COVID recovery for the municipalities. And again, those monies won't be in, and I guess we get our first distribution perhaps in early May. But Chief Hicks, again, would have to speak directly to what his needs are. And I think we could, certainly look at that and figure out how we could get him some help, but it's really dependent on what he thinks might work.
It's not so much a funding problem, it's a personnel problem. And this is a nationwide issue long before this problem came up. We still have 2 openings that we can't fill. We're not getting any, nobody's applying. And when we do get applications, a lot of them don't meet the standard, and there are police standards that they have to meet before we can hire them. So that's been the big problem, is getting qualified applicants to fill those roles. We have 1 in the academy now. When he gets out, we'll be up to 4. And then we would have 1 more opening, but it's finding qualified candidates. It's not so much, and we threw money at it a while back. We raised the wages $5 an hour across the board to attract more applicants in it, and we did get some, but getting them through the process, and it's a long process. It's, it's difficult, and it's not so much a money issue as it is a people issue.
Okay, well, I got one other question, if I may. The mask rule that Helen put into place, is that enforceable under Ordinance 1185, and can we associate some value of a fine to that? Right. I think that's really the only one that's going to be super easy to, write a ticket for. The rest of them, 6 feet apart. I mean, you got a tape measure, that's not going to be super easy to do that. But the mask is an easy one to hold people accountable on. I just want to make sure that the way it's written, we can fine an individual for that, the way that's written.
Yes, we can definitely fine people. The mandate, the fine that you guys approved, the ordinance for fines, was up to $500, and this mask rule will fall under that, up to $500. And we, Hicks and I discussed a fee schedule that would be up to, it was $50. Our goal with all of this is to not slap fines on people as much as just encourage that they follow the rules. And if they don't, obviously, enforcement will come into play. I think I heard Governor Cuomo basically say, yeah, just try to walk down the streets of New York City right now without a mask on. You're going to hear about it in the most New York way possible. And I'm going to guess that a lot of the enforcement of that mask rule is going to come from citizens who are concerned about the people who are standing around them not following the rules. That's asking a lot of our community, but I certainly hope all of us can be good citizens and make sure that all of us are complying with the rules.
So council, maybe I can go back to a structure so that we can incorporate comments again. because we had Native Village VAC went through and kind of shared items that they had concerns with. So maybe we could do that with council. And I'll just have an order here of Councilman Meyer and then Baylor, and then I'll go through the list. Councilman Meyer?
Yeah, I was just kind of taking off of the conversation that has been happening just now about enforcement, and wanted to ask Hicks if, because I remember it was quite a few years ago, but there used to be people that weren't police officers, but they did parking tickets on Main Street. Is there something like that that we could do to hire people that aren't full-on police officers, but maybe people who are up to date and could get somewhat just local training on what our mandates are to be out there in the community telling people to put them on, and they can call for police backup if they need to be, but under the police umbrella still.
We used to have a community service officer. It was full-time, and I held the position for about 1.5 years before I became a police officer. And then sometime after I left the police department years ago to work for the troopers, they made it a seasonal position. And, excuse me, and that's something that we could look at as an emergency hire probably. I think Helen would have the authority to do that. And that's an excellent idea. And I think I know of a couple people that might fit that role. We may have one in town that did have some experience doing that at one time seasonally. So yeah, that is a real good point. If we could get one or even two of those folks out there on the streets, it would take minimal training. Yeah, that's another option. It's a really good option.
Okay, did that answer your question, Councilman Meyer?
Hello?
Councilman Meyer?
Sorry, I was with you.
Okay.
Thanks, that was a good, I think that would be a route really worth going down. And if you need extra funding from council or anything, I don't want to have to wait on seeing what we can get from the CARES program or not. So if you need some extra funding, I would encourage you to bring it to council, because I think even hiring more than 2 of them would be very appropriate during this time. And maybe we could even get them out of the airport, be able to help with the harbor, walking the docks, things like that. I think we need to really be proactive in doing. And so hopefully something like that, get what you called them, would be a good avenue. And I'd be very supportive of that.
Councilman Baylor.
And a little thought of humor, I'm envisioning the iceworm beard police that go around.
Well, they already have their own uniforms, so that wouldn't be a problem.
And sticking with enforcement, you don't have to answer this now, but the thought occurred to me, again, going back to the situation where you had a boat come in, there's multiple people on it, person's sick, you take them up to test. You don't want those people on the boat to be wandering around. Under our fine ordinance, do you have the authority to say you have to stay on this boat? And if you do have that authority, if you don't have it, then we probably need to get that in there. And if you do have it, then it's simply a matter of maybe from somebody from the harbor or something. You wouldn't have to tie up an officer. They said, once you tell somebody you're going to $500 fine, they're going to stay on the boat. So just that thought process too. And I don't know if that covers it. And if it doesn't, then we probably should make sure it does.
It does, because the mandate says if you enter the community, you have to self-quarantine for 14 days. So if they're refusing to do that and wandering around town, they're in violation of the mandate, which is a $500 fine and a mandatory court appearance.
So you wouldn't have to tie up one of your officers' time, I think, if you designated somebody, just keep an eye on this boat from a distance. Then if they get off, they're going to get a $500 fine, and then they're going to call you. And
that would be under the community service officer program, potentially, if we had somebody to do that.
Yeah, everybody's got a cell phone. They see them get off the boat. It's
well, yeah, I mean, people call, they call us all the time for different things, and
you got it.
So yeah, I mean, we get reports, they call in the station on something, we investigate it, and we resolve it one way or another, the best we can.
So City Council, we're just going through and asking, are there suggestions for the airport plan, harbor plan, or things you'd like to see? And Councilman Allison.
Yeah, I'm with Vice Mayor Meyer on what she said, and I know our staff and the mayor, the attorneys are all working together on things. I think bring us some proposals of how we can work together. I think to steal a thought, tribal council member Hopkins had at one of our meetings in the past. We need to see some action and quit talking about it. We talk about this. We have meetings all the time, and seems like we're always saying we're going to do this. We're going to do this. Let's get on it and get it done. Looks like we've got money coming to fund some of these things, and we need to get on it. People in the public need to see some action. I know, and we all know, sitting at the table, that a lot is being done, and people are working their butts off, more hours than they ever thought they would or should. But the public doesn't see that, and we need to get that visual aspect out there in the public. So I'm in favor of doing whatever we can to be public about things out there. Thank you.
Thank you. Councilman Sherman?
Thank you, Mr. Mayor. I have one quick comment. I heard Brooke and Denna's name mentioned to be part of IMT and Unified. I'd really like to see that happen. I think just having someone from NVE at the table, the meeting, helps us with communication and sharing our resources. And I too is going to, again, I'm answering the Cordova Prepared emails, and I am hearing pretty much what Mr. Allison was just referring to, a need to see things. So signage up at the harbor in all places, flags for people who are quarantining, and then a definite need for enforcement. And I completely agree with Vice Mayor Meyer about the community service officers, and I would say anywhere between 6 to 10 at least. And that's all I was going to ask too, maybe the medical team could be tasked with working on the testing plan, or maybe they're already doing that too. That's all.
Okay. Thank you, Councilman Sherman. And I'm kind of keeping a placeholder to talk about testing a little bit as we go through this round. Councilman Gleason.
Yeah, I'm with Melina. That's an awesome idea, and I think that the sooner the better. So I don't know if we can direct Helen to put that up, post that employment opportunity immediately, or if that's the will of council. But I think the sooner we have those people, working, the better, because the fleet's about to arrive, and so the harbor to me is our weak point. So,
and that
and
might
we also need to assign some values to define. We haven't even talked about that, and I don't know what Chief Hicks' capabilities are in there. If he can just decide on the spot what it's going to be, but we should probably give them some direction on how much it costs if you get caught without a mask, or if you're in a vehicle with 8 people. Obviously, you're not social distancing, so how much does that cost, and so on and so forth. So that's something we need to put on something we need to have on the future agenda there, the near future. So that's all I have.
I was just going to circle back to the tribe. We're kind of discussing some very specifics, but I'm wondering if there's any way that you envision you might be able to step in and participate in these solutions. You don't have to answer me now, but I certainly invite that. If we need enforcement you might have.
I'm out. We're really digging into tactics right now. And we need to back off on the tactics part.
Exactly.
I think we're digging into the weeds right now. So I just want to make a comment about that.
I appreciate that. I thought that might be where Helen was going, but Councilman Gleason, I don't know if you heard earlier, there's already a $50 fine in place for the masks. Helen and Chief Hicks have established that. He's been a lifetime law enforcement officer, knows what the state laws and works with the courts on doing all that. We start telling him how and when and what to do. We're going to slow him down, and they're going to have to start worrying about what the fine should be instead of keeping the community safe. So, but we appreciate the comments, and your team are sitting here listening, so they're taking this under advisement. They're trying to get to the goals that you have for them.
I wasn't saying order them around. They're asking us for direction. I didn't know if that was, and that's why I said I don't know if he can do that on the spot already. But if he can't, that's all I was saying.
Oh, okay.
Correct. We have to do that. But if they don't need any direction in the fine department, then fine. That's fine too.
Oh, okay. I misunderstood. I thought you had heard earlier that they had established a $50 fine, and you thought that should be changed, and council needed to put that on an agenda or something.
No, I missed that little tidbit. Sorry.
Okay. Councilman Gleason, did you have other thoughts or things you'd like to see?
No, that's it.
Okay, thank you. Councilman Guard.
I think most of the stuff I've been thinking about has been fairly well covered by everybody. I just wanted to make one statement on fines, not so much to get into the nitpickiness about it, but these fines were always intended for an educational tool. I don't think you're going to beat anybody into submission with a $50 or a $500 fine. But if they can just be used as an educational tool, was all they were ever designed as. Thank you.
Okay, thank you. Councilman Schaefer.
Hi, no, I don't have any additional thoughts really at this time, other than I support the enforcement idea that Melina suggested, and then also support a testing plan that was also brought up, being developed by the medical team, and just, continue working through those plans, how we're going to protect elders and compromise in the community as people come to town. So just keep working on the plans, and we want to see them even if they're working document.
Okay, thank you. So what I'm kind of hearing is policy direction, request from tribal council, and policy direction from the city council is step up enforcement, and we'll make resources available for that. And I think that the team has heard that here, so thank you. I just wanted to circle back to testing, because Bert and I particularly had kind of mapped this out a little bit, and we kind of have a current status. Chairman Olson, if you don't mind, if Bert or I just shared a little bit, at least to let both councils know what, and also I wanted to let City Council, and you know that Dr. Sanders is online and available, and City Council had asked that the medical team be available in these discussions because this is a medically driven pandemic.
Yes, Mayor Copeland, please do update us on testing.
Okay, so I'm going to defer to Dr. Sanders because there are tons of testing opportunities and all over the map out there. But I think it would maybe be good to hear a little bit about what testing can and can't do for us, because I think there's some misconceptions about the accuracy and efficacy and usefulness as a tool, and also maybe the perception that that we aren't very aggressively monitoring and pursuing testing opportunities. I just wanted to share for the groups that Senator Murkowski called me this morning and just reminded us that the Senate just passed a $25 billion package specifically for testing. The state of Alaska is going to get a share of that, and we can pick up, she encouraged us to pick up the phone to the governor's office if and where we see tests that could be useful for us as we enter our fishing season. So, I wanted to share that support with the community. But so actually, Bert reached out and with some testing ideas and some resources. And again, this is a great place where we don't know if there are rules and regulations and legal requirements through Medicare and Medicaid and whatnot. CCMC may not be able to offer tests for free. They may have to charge a big $140 or $150. That's something that the tribe may be able to waive. Conversely, the tribe has requirements that they may not be able to. So this is a place where the tribe and CCMC can work together to maybe make something happen that neither one of us could make happen independently. So in that vein, we just talked about opportunities, and what we kind of mapped out is A, financial resources, and B, going to the medical team and see what their guidance was on testing and what type, so that we could jointly work to pursue that. And we already started a little bit with public service announcements yesterday and a public a press release regarding the collaboration, because we think that'll strengthen our position if and when we go to the state and asking for financial or directly for testing resources. So that's kind of where we're at right now, is that if and when and where the medical team says, yes, this is one we can use, then we can rally and pursue that. So with that, I'd let Bert weigh in, and then perhaps Dr. Sanders.
Okay, thanks, Clay. Before I talk about the testing, I want to just help the progress along on incident command discussion. The Unified Command is also listed as an option in the city emergency operations plan. So I hope that helps along in speeding up a decision on the tribe and its position to be on a unified command. In regards to testing, Clay, as Clay has said, we've been talking and really trying to come up with a plan, and as he said, and I'm sure as Dr. will support, is that it's a very daunting task to get through the different methods of testing that kits available, what would work for Cordova's situation, but to really let the public know that this is a priority on both sides. Priority that staff has really been putting a lot of time and effort into as well, and I think the Joint Unified Emergency Group is playing a part in that as well. So I think taking the information from them and what they have to say is going to be huge for the tribe and the city to support when it's time to come up with a testing plan. And I think we really need to work on getting the state of Alaska, and they may already are on board, but they need to play a big part in terms of what Cordova is looking at as a testing plan. And then the funds that Clay was talking about, that Senator Murkowski talked about, I think is big. So I think step one is trying to find a testing method as soon as we can, so we are able to understand what the supplies or the testing supplies or kits will be needed to really do a good testing plan for Cordova.
So, Dr. Sanders, short of putting you on the spot, I wonder if you wanted to share anything in general about testing.
Yeah, absolutely. So let's start off by saying, just giving you kind of my terminology. When we talk about testing and we talk about a screening test, we're talking about people that have no symptoms and need to screen to try to identify symptomatic carriers. In Cordova, diagnostic testing available for anybody with any COVID.
Say, Dr. Sanders, for some reason you're cutting out. I don't know if you can go to headphones or maybe.
Oh, is this better?
Much better.
I'll just repeat what I said. In my terminology, when I say screening test, I'm saying screening looking for people with no symptoms, trying to identify asymptomatic carriers that may expose others to COVID-19. A diagnostic test is what we currently have available in Cordova. The diagnostic testing is what insurance companies cover. We use the Abbott ID, and the state will also run the samples for us. The state right now is not advocating for any screening tests. So we can't send screening samples to the state lab, and we cannot use the Abbott ID now for screening. There are many companies that are offering different types of screening methods. So the ideal one for our community would be one that does the reverse transcript-based PCR. These tests are collected usually with a nasal or nasopharyngeal swab. How effective the test is at finding virus depends on how well the swab is collected and how it's handled afterwards. So we need to make sure the people that are collecting those are trained and know how to collect them. If we're rolling out large screening to, say, a population like the fish processing units as people are coming in, this logistically is a lot of work to organize, and this is what our team is working on trying to figure out right now. How do we organize these logistics, making sure that we have the information on the person that's being tested, we collect the test appropriately, we send it to the right place, and then get those results back and are able to find the person and identify them with the right results. Those little things, it sounds like, oh, that would be simple, you just put a sticker on or whatever. It's a lot of work to figure out those logistics. And the other piece that you touched on, Clay, is figuring out, well, what are we allowed to offer in terms of the collection fees being waived and who can waive them and who has the manpower to be able to roll this out. So we are looking at that, trying to find what, for many companies that are offering that test to us, I think we can probably have a test run at a company for around $40 to $50. It's all the other pieces that we're working to get put into place. There's another type of testing that is an antibody or a serology test. This is a test that I wouldn't recommend at this point for local people in Cordova. It might be a good test to give to people that are coming from areas where there's a high level of community spread where the person is traveling from, or if they're traveling through areas that have high community spread. If you do the antibody test without high numbers of community spread, you're going to have more false positives than actual positives. So I think that right now, it's a little premature for our community. The state has also given us that guidance that we're not ready for that test yet. Any questions?
Okay, thank you, Dr. Sanders. And I think Chairman Olson, we are over an hour now, so maybe I'll turn it over to you and Tribal Council for any final questions on the testing, or Dr. Sanders, or comments.
Sure. I was just going to make a note. I read an article about Unalaska Dutch Harbor and their testing. That's why I brought it up today. But go ahead. At this time, I will ask Tribal Council if you have any questions or comments about testing. Tom Anderson?
I don't have any. I don't have any on testing. It seems like the Lanka has it pretty well under control. So I'm kind of happy with what they're doing down there.
Okay, thank you, Tom. Tom Smith?
Yeah, I'm the same as Tom. I don't really have any direct questions. Sounds like you guys are doing your homework, and I'm just hoping the best for Cordova when we really need this testing and to help our community. That's all I got. Thanks.
Thank you, Pam. Jack Hopkins?
Just keep getting all the supplies you can. That's all we can do. Thank you.
Thank you, Jack. Raven Cunningham?
Yeah, I think everybody else said it. I don't have any more questions to ask. I'm very happy to hear that our two medical systems are working together. Also, thank you.
Thank you, Raven. Those are the only comments Tribal Council had.
Okay, thank you, Chairman Olson. I'll go to City Council. Councilman Allison?
Nothing more from me. Thank you.
Thank you. Councilman Sherman?
Nothing more for me either, thank you.
Thank you. Vice Mayor Meyer?
Yeah, just one comment or suggestion. I don't want you guys to take this as nitpicking, but maybe the incident command team notes, minutes that council is now getting pretty much on a daily basis. One thought is maybe sending that to either Bert or all of NVE's council so they can see a little bit what's happening behind the scenes. And then that way, if they have something to offer, that would be a good starting point to get going right away so that they can have input. And I'm very supportive of a unifying command structure, if any way that we can do it. I think that there was a lot of good discussion today about training people, getting some community service officers in rotation. I would like to see them in some kind of bright colored t-shirts so that they're easily identified and wearing masks. And I think that that would be a good show. I know a lot of us are just at home, so we venture out just to go to the grocery store or just to pick up our grocery list. But I think when we see that and see people out and about and being able to help with the enforcement side and just showing, it's just a face to show it. And so if other people are out and about and they're seeing somebody in a bright colored shirt, then they know that they can see the action being taken. And I think that's a step that maybe a lot of this stuff is being handled behind closed doors, because that's kind of what is happening with what is going on in the world. You know, we're social distancing and we're not having public meetings where anybody can walk into, where it's very behind the scenes type of a thing. So whatever we can do to show it, even signs that don't say mandate stuff, but just wear masks, we do stuff like that, I think that would show the community that stuff is being done. Thanks.
Okay, thank you. My list here. Councilman Gard?
Yeah, no comment. I think everything's been covered.
Councilman Schaefer?
No comment at this time. Thanks, everyone.
Thank you. Councilman Gleason?
Yeah, just one comment. I made this comment in our last meeting, and I believe Raven asked this question in a letter, and I was just going to let the tribal council know that subsistence fishing is open and unrestricted under state health mandates this year, so it's going to be the same as it's always been. What that means, Cordova, is you can subsistence fish Monday, Thursday, and Saturday. Same as normal. You can bring whoever you want on your boat. That's all I'm going to say.
Thank you. And Councilman Baylor?
Yeah, you know, I think there's some good ideas and discussions here, and I think Mr. Gleason or Mr. Allison spoke to it. Just because one council person says something, that doesn't make it code, or that doesn't mean yet the incident command team has to go out and do that. These are just suggestions, and we're not pulling out these suggestions and ideas off our backside. We're getting this from the community. They have their questions and concern. They do relay those through council. So I think the sensitivity that was shown here about, oh, we're getting into the tactical or this or that, these are just suggestions. These are concerns. They're being brought forward. Now, as a group, if we take them up and start trying to give direction, yeah, now you're getting into tactical things. But I don't want to stymie anybody's thoughts or ideas on how we can build a better mousetrap. So, and I think trying to jump on that right away can have that cause. So for the folks in NVE and for the rest of the council and for the community, if you've got thoughts, ideas, you know, that could help this situation better, bring them forward. Don't be afraid about that. And hopefully we'll get a hearing. And if it's something incident command team can use, then it'll be up to them to adapt it and work out the kinks and make it happen. So please keep bringing your information forward. It's helpful.
Thank you, Councilman Baylor. And that just reminds me also for the public and council and all of us actually, as the public approaches us with ideas, encourage them to also either submit those through Cordova prepared at yahoo.com or to the incident management team, because that's where it can get the quickest review and operationalize it. And so with that, if there's no objections, we could go to adjournment. So I just leave it open for a minute here for any objections or any final comments across the board before we move to adjournment.
No objection from NVE.
Okay, council, I'd entertain a motion to adjourn.
Move to adjourn.
Second.
Have a motion and a second. I'll wait for objection. Okay, hearing none, we're adjourned. We'll take a 3-minute recess and then go to the city council special meeting.